Good day, everybody. First of all, I would like to congratulate Ms. Gulnas Tariq Mir, the president of the World Union of Wound Healing Society Conference, to make this event happen and for giving me the opportunity to talk about the evaluation of the quality of wound and ostomy care services virtually, telenursing in Indonesia. My name is Hamka, founder of Stoma Nurse Ostomy Support Group Indonesia, SOS Indonesia. SOS Indonesia is a non-profit organization established to support ostomy and their family. And I am also a Stoma Nurse consultant at NCI Center Kalimantan, the private nursing for ostomy wound continence care services. And I'm a researcher and educator for health worker for ostomy, wound, and continence care. And I'm chairman of the Board of Nurse Association. This is my disclaimer that the information presented is related to the evaluation of the services program from the NCS Center Kalimantan Health Facility for all Indonesian people who receive services. This presentation will begin with a phenomenon that has occurred in Indonesia regarding stomach care and complication in peristomal skin wound during the COVID-19 pandemic. And the second will explain why evaluation of virtual care services is needed. The third is the method performed on the virtual services telenursing. And the fourth is how to report the evaluation result of virtual care services. And the last is how to discussion on and conclusion can have an impact on virtual care services. Over the past decade, we have identified a shift in focus on this issue. In the last 2 years, we turned to focus on post-operative anastomotic complication. The COVID-19 pandemic has become a frightening thing for the Indonesian population, making wound and ostomy care to be carried out independently by families for pediatric patients. In addition, the demographic of the Indonesian territory as an archipelagic country provide is it is own challenge to provide standardized how to give the best ostomy and wound care services in all regions in Indonesia, so that wound and ostomy care services virtually telenursing is a solution to the problem of ostomy care services and their complication during the COVID-19 pandemic in Indonesia. The objective research is telenursing is a virtual wound and ostomy care assistance program provided by relative to patient who have recovered 94.9% of their function. We have created a special group for patients of ostomy babies with 90 members in it. This program has been running for 2 years, and we are evaluating services to our virtual services recipients. The method, this study used a descriptive approach with 45 respondents from Indonesians for Langers Island, measuring 4 parameters on a Likert scale to assess the quality of care services. They come from 4 major islands in Indonesia. They are Java, Sumatra, Borneo, Celebes, and the Bali Island, with the longest number of respondents living in Java, namely 75%. Maximum respondents are age is 20 until 30 years old is 65%, and 73% of respondents are mother of ostomy babies who have wound complication. This study examines the performance of nurse in providing telenursing assistance toward indicator of empathy, reliability, responsiveness, and assurance. Question item posed to respondents consists for indicators such as empathy, responsiveness, and assurance. The data analysis technique used in the study was the SPSS computer program. The analysis that will be used in this research is the reliability test, validity test, correlation test, factor analysis, and multiple linear regression analysis. Multiple linear regression analysis is used to determine how much the independent variables, in this case the dimension of services quality in the form of empathy, reliability, responsiveness, and assurance can influence or explain the variable, namely patient stratification. The results, our respondents with an empathy attitude are 100% extremely stratified, 100% very satisfied with the reliability, 100% very satisfied with responsiveness, and 75% very satisfied with the guarantee. The discussion and conclusion, according to Giptono, state that services quality is the level of excellence expected and control over the level of excellence to meet customer desires. In this case, our patient and family will get virtual ostomy and wound care assistance services. And clinician must pay attention to quality when using technology to treat the patient remotely. Empathy, reliability, responsiveness, and reassurance must all be in the principle of wound care. The effectiveness of virtual wound and ostomy treatment has been shown to have a measurable beneficial impact in terms of the healing index and patient stratification. This is the reference. It's all. I hope that what we are doing for Indonesia encourages everyone to improve and develop excellent stoma treatment and trauma stoma treatment on the pandemic COVID-19 condition around the world. Thank you.